Weight loss is medicine. Now, before you scroll past me, give me a second to explain. My name is Golfran Rivera. I'm a board-certified physician assistant. I practice family medicine and sports medicine here in beautiful Fayetteville, North Carolina. Now, I understand that weight is a touchy subject, and unfortunately, many of you have already ran into a primary care practitioner that dismissed a lot of your health concerns and acted as if it would all go away if you would just lose the weight, if you would just stop eating the food, if you would just do the exercise, right? Now, I'm not here to promote the same misinformation. However, if we are going to practice holistic health, we do have to take our body weight into consideration. Body mass index, BMI, is not the end-all be-all to health, but it is an important factor. And in this video, I want to talk to you about 3 conditions that I manage every day in clinic that can actually benefit from weight reduction in those patients who do stand to lose some weight. And I hope to offer some perspective and hopefully some encouragement for those of you who have been struggling with your weight and are concerned about the impact that it's going to have on your health. As a primary care medical practitioner, I see a lot of different kinds of health conditions. Everything from the sniffles to heart failure to autoimmune disorders and all kinds of things in between. Something that I run into on an almost daily basis is diabetes. More specifically, type 2 diabetes. Now, for those of you who aren't aware, there's actually several different kinds of diabetes. And I want to talk to you specifically about what's commonly known as type 2 diabetes. It has different names, and the names have changed over the years as we've come to learn and understand a little bit more about the condition. But for simplicity's sake, I'm going to talk about it as type 2 diabetes. Now, diabetes is a very important medical condition to understand. The American Diabetes Association reported in 2021 that over 11% of Americans, which is about 38.5 million Americans, deal with a form of diabetes, and 90 to 95% of them are dealing with type 2 diabetes. Now, if you'll bear with me for a second, because I get so many patients that don't have this explained to them, I did want to share with you what the most recent research shows about how diabetes comes about. The actual study was published in the Cell Metabolism Journal, and I have the link in the description below. But it talks about what has come to be known as the twin cycle hypothesis. Now, the simple rundown version is this, that over time, as we eat food, as we live our lives and we're consuming food, if we, on a regular basis, consume more than the amount that our body is expending, more than we're using to stay alive, more than we're using to do our day-to-day activities, and for anybody who exercises, more than what we're exercising, over time, the body begins to store this excess energy as fat. Now, normally this is not problematic if the body is able to store it in places like under the top layer of skin in the arms, in the legs, in the face. It's not too problematic. But as time goes on, and depending on each individual's genetics, the body begins to store this fat in the liver. Once it does this, depending again at different levels and for different people, the liver becomes less sensitive to insulin. Now, insulin is produced by cells inside the pancreas. So what happens is the pancreas is sending insulin to the liver to then signal the liver to do its job and help managing the different blood sugar levels. But as fat cells begin to accumulate inside of the liver, it becomes less responsive to the insulin, and is what we call insulin insensitivity or insulin resistance, right? So then what happens is the pancreas responds by increasing the amount of insulin that it produces because the liver is not responding, right? So think about it like this. The pancreas normally talks to the liver and says, here's some insulin, right? It talks to the liver via insulin, and it's basically telling the liver, hey, I need you to take up the sugar into yourself, store it up, and so that the blood sugar levels aren't rising, right? But also what this does when insulin is present is that it also tells the body to begin to store fat or create fat. And so here becomes the problem is we already have fat inside the liver that's making it so that the pancreas has to speak louder by producing more insulin. The liver is not responding as well, and so higher levels of insulin do lead to accumulation of fat or more production of fat. And where's the body going to store it? Again, more inside the liver. And as this cycle continues, it eventually begins to store it in the pancreas, where the cells are that produce the insulin, worsening the problem, making it harder and harder for the body to make use of insulin, until eventually what seems to happen is that the pancreas kind of give up and it stops producing insulin altogether. Again, that is a wave top explanation that a lot of my patients don't seem to understand. They're not informed on this. And the reason it's worth understanding this is I want you to catch where this all started, okay? It started when we were on a regular basis over-consuming energy, more energy than we were expending. Now, this is not me getting to say this is about calories in versus calories out, but calories did play a role in this. They did play an important role in this, as well as genetics, right? And we're not talking about the particular source of those calories. What we're saying is that in general, what happened over time is that we were over consuming, and the body had to store that energy somehow, some way. And as this process continued, it started to store it in the places that would impact insulin and the use of insulin. And then we end up with type 2 diabetes. When we understand this, we can begin to understand the results of the diabetes remission clinical trial, known as the DIRECT study. It's actually one of my favorite studies because it's so very relevant to what we're talking about. The researchers set out to answer this important question. They set out to assess whether effective weight management in the primary care setting could lead to remission of type 2 diabetes. Now, again, as a primary care practitioner, that's a very important question. Now, this wasn't a big study. There was 298 participants, split in half. But the results were so very important that I wanted to share with you guys. First of all, there was two groups, the control group and the intervention group. Now, the control group received care as usual, right? The things that you're used to is they measure your blood sugar, they give you your metformin. If you can't tolerate metformin, they give you some, a sulfonylurea, something else, and they kind of follow the algorithm as to manage the blood sugar levels. The intervention group followed a strict 800 to 900 calorie a day restricted diet, which they accomplished with meal replacement shakes. Now, one of the authors in the study, Dr. Roy Taylor, goes on to explain that the nature of the shakes themselves wasn't what they were worried about. They just wanted to make sure the shakes had some nutritional value and that it helped the participants control the amount of calories that they were consuming. Okay, so for 3 months, the participants in the intervention group replaced every single one of their meals with the meal replacement shakes. So 3 meals a day is what they were doing, but it was replacement shakes, and they stayed somewhere between 800 to 900 calories, okay? And then after 3 months, they slowly began to reintroduce food in a structured fashion, and they followed them all the way to a year. Now, what were the results? They found that 24%, or 36 of the individuals in the intervention group, lost at least 30 pounds or more. 46% of them, that's 68% of the people in the intervention group, actually achieved diabetes remission. Almost half of the people that were in the control group. And then 109 of them, 74% of those in the intervention group, no longer required medication to manage their diabetes. Compare that to the control group, where nobody in the control group received that level of weight loss achievement, and only 4%, about 6 people in the control group, achieved diabetes remission. And only 18%, or 27 individuals in the control group, got to where they could get off of diabetes medication. That's a big difference. And in his book, Life Without Diabetes. One of the authors, Dr. Roy Taylor, again, who, by the way, is an endocrinologist, this is kind of his thing, explains that they believe that the real benefit of this, or how this came about, was through the weight reduction. To be clear, I'm not insisting that in order to treat diabetes, we have to go on a strict calorie restricted diet. And I'm not saying that the way that it was done in the direct trial is the only way to do it. But what this shows us is that weight loss can actually lead to remission of diabetes, or at the very least, it can lead to our patients needing less medication, which is one of my favorite things to tell patients is my goal. My goal is to get you off as many of the pharmaceuticals that you're on. And this trial is a big part of that. Now, they go on to do other follow-on studies to replicate the results. And I have seen this in my clinic where when my patients are seeing that weight go down, guess what else is going down on a regular basis? Their blood sugar. And on top of that, we also start to see a reduction in blood pressure, which is actually the second condition that I manage often in clinic with effective weight reduction. Now, blood pressure is a very big deal, y'all. I don't want to overemphasize this because I hate fear mongering and I hate, creating this sense of doom and gloom. But hypertension, or elevated blood pressure, abnormally elevated blood pressure, does have some important health consequences. Almost half of Americans, according to the American Heart Association, are dealing with either stage 1 or stage 2 hypertension, or severe medically elevated blood pressure. Why this condition is so important is that, like diabetes, it can increase our risk of heart attack, stroke, different kinds of blood clot, damage to our blood vessels, damage to our kidneys, damage to our eyes, all kinds of different things. And the reason I care so much about blood pressure is because we call it the silent killer. And a lot of my patients who aren't concerned about their blood pressure tell me all the time, but I feel fine. The thing is by the time you feel something when it comes to hypertension, it might be too late. Because whether we know it or not, when our blood pressure is consistently elevated, that damage I already mentioned is going on. And it's often just a matter of time. Now, again, I don't want to overstate this, because there are people that live with really elevated blood pressure. They go on to live normal lives. They never end up in the hospital. They never have that stroke, that heart attack. And there are people with normal blood pressure that do. But when it comes, the way I like to tell my patients is this. If someone said to you, I'm going to offer you $1 million if you could pick between these two people, which one of them is more likely to die from a stroke or a heart attack, your best bet to try to win that $1 million is to pick the one who lives with uncontrolled hypertension. Again, that doesn't mean that the person with normal blood pressure wouldn't be the one, but when we talk about the odds, right, when we're trying to balance risk, elevated blood pressure, hypertension, definitely puts us at risk for these health issues. Now, what does weight loss have to do with it? What's interesting is that the direct trial I've already mentioned for diabetes showed us some pretty neat results for those patients that lost weight. In the intervention group, there was about 80 people who started off the trial on blood pressure medication. By the time the trial was done, 38 of those people, almost half of them, were off blood pressure medication, because they had gotten to a point where their weight reduction had improved their blood pressure to such a point that they didn't need the medication anymore. And then there's this study that was published in the Journal of Hypertension, the Journal of Clinical Hypertension, published in 2023. This was a study of studies reviewing all kinds of different studies. They looked at 35 different, with a total of about 3,200 to 3,300 patients. What they found is that if an individual were to lose about 15 pounds, plus or minus, the top number on the blood pressure, that systolic blood pressure, can actually go down about 7 points. Now, when we compare that to most of the blood pressure medications we use today, honestly, that's not as high of an impact that we can get from the blood pressure medications. That's just the truth. However, when we consider the side effects associated with blood pressure medication, coupled with the benefits of weight loss, right? We've already talked about how it can lead to diabetes remission and other issues, which one more I'll talk about in just a second. And we're weighing kind of the cost and benefit of using a pharmaceutical versus trialing weight loss. You might see why I like to encourage many of my patients to start with weight loss, especially if they're just within what's called stage 1 hypertension. If that's the point where we're not seeing anything dangerous, and this is the first time that we're really considering treating the blood pressure, I always like to give them a 3-month trial of weight reduction through diet and exercise before we start talking about pharmaceuticals. Now, you may have noticed that I've referenced a few times my perspective on pharmaceuticals, but just in case you're not familiar with my philosophy, I am very comfortable prescribing pharmaceuticals when they're indicated. But the more that I can keep my patients off of them, the better. And the real reason for that is that pharmaceuticals are not benign, okay? They're not without their risks. And every single time we prescribe medications to our patients, we're exposing them to that risk in addition to the potential benefit. So if I can manage something and help them reach a health goal without the use of pharmaceuticals, the better. And I feel this way as well regarding the treatment of depression or depressed mood or anxiety, which these are very important conditions that I see on a regular basis as a primary care practitioner. And the interesting thing is, I'm not claiming to be a psych expert. I'm not a psychiatrist. I didn't receive special training in psychiatry. I'm not a psychologist, none of those things. But the truth is that the vast majority of psychiatric care is taking place in the primary care setting. And you would be astounded the number of patients that I see where the reason they're coming to see me, the reason they've scheduled an appointment, is to discuss issues with depression or issues with anxiety or some sort of psychiatric disorder. Now, depression, or specifically depressed mood, is a very serious issue that impacts a lot of Americans. The National Institute of Mental Health reported in 2021 that approximately 21 million U.S. adults had experienced at least one major depressive episode. And again, based on data from 2003, at least 60% of psychiatric care for depression was coming from primary care practitioners. And my own experience tells me this is something that I need to have an idea of how to manage. How weight loss comes into the discussion is when we look at some of the research that has shown the impact that weight loss has had on depressed mood. Now, to that, I turn to a study that was published in the Journal of Personalized Medicine in 2021. It was a study of studies looking at 24 different studies, over 3,000 patients included in that, and they try to calculate the effect size of different dietary approaches for weight loss. And what they found that in general, patients who achieved weight loss through some form of calorie-restricted diet did find improvements in their depressed mood, and they had the most improvement in their depressed mood. Now, in my opinion, looking at the study itself and looking at those effect size, I feel like it's small. However, when we take into consideration the other benefits that I've already talked about, I think it's, even if the effect is small, it's worth noting and appreciating that we are seeing that weight loss can improve people's depressed mood. But a study that I found very interesting and very fun is a little bit of an older study that was published in the International Journal of Obesity in 2011. This was another study of studies looking at 31 different studies, putting them together, and it included close to 8,000 patients. And what I really found interesting about the study was they were more looking at the different ways that weight loss impacted depressed mood, but not so much the amount of weight loss, just the impact that the different approaches had. And what they found is that lifestyle modifications such as diet and exercise had a much bigger impact on depressed mood than pharmaceutical weight loss, looking at pharmaceutical weight loss. And why I thought that was so interesting is essentially the things that it takes to promote weight loss seem to, at least according to this study, they seem to also result in improved mood. And when we think about that, that kind of makes sense, right? If we can teach people how to make intentional decisions for their health that can lead to a healthy weight, and we're talking about the way that they eat, the way that they move, the different intentional decisions that they're making in their life, you can see how that would also improve mood. And so taken together, this becomes a big reason why when a patient is dealing with depression and they find themselves also battling with their weight, it becomes a big deal to be able to empower them and help them in their weight loss journey. And I'm not saying, to be clear, I'm not saying that depression, anxiety, and these kinds of issues are the result of excess weight. That's not what I'm saying at all. There are plenty of people who have great lives. They feel very satisfied with their lives, and they would be considered overweight or even might find themselves in a category of obesity. So that's not what I'm saying. What I'm saying is that for patients that are wrestling with their weight or have health concerns and are also experiencing depressed mood, that there's good evidence that shows us that if we can make intentional changes that can promote weight loss, we can also see alongside that an improvement in mood. And I think that's a big deal, especially when we take into account the things I've already mentioned. And I won't even go into all the other benefits of appropriate weight reduction. So kind of bringing this video to its close, I want to review what it is I've talked about and what I hope are some of the takeaways. Now, first of all, I want you to understand that weight reduction is about so much more than what we're seeing in the mirror or how we look in bikinis. And it's about so much more than that for me and for my patients. I understand that weight loss and weight management is very frustrating. We live in an environment that helps promote weight gain, and that makes it very difficult. I just wanted to, in this video, encourage you and give you some perspective and explain to you, look, managing weight is about so much more than appearance. It's not vanity. It is medicinal. We can actually cure diabetes in some patients through effective weight loss. We can actually get people off of blood pressure medications. We can actually help people improve their day-to-day mood and maybe even avoid the need for pharmaceuticals to manage mood disorders through weight reduction when it's appropriate. If you've watched this far and you're wondering, okay, but how do I lose the weight? Yes, understand weight loss is medicinal, but how do I take my medicine, right? How do I actually lose the weight? Here's the thing. There's some general principles that I think are true for everybody, but weight loss is an individual journey. This is why it's useful to find yourself somebody who can partner with you. Me here at True Care DPC, weight management is something that I talk about with most of my patients because I believe so strongly that it is medicinal. But it may not be your primary care practitioner who's helpful in this, because frankly, most of us don't get the training in this. I have gotten training as a nutritional coach and as a fitness trainer, and that's where I learned so much in this, and then I put it into practice. But not everybody receives that. I'll tell you that it is worth your investment to find a health coach who can give you that personalized approach. But so that you're not left empty-handed, I wanted to give you some general recommendations that are generally true for most people. If you hear this and find that it's not true for you, you're more than welcome to reach out to me and see if maybe I can give you some personalized assistance. Now, the first thing that I generally consider to be true is that more than exercise, and this is where people mostly move to for weight loss, is I don't have time to exercise. I actually feel that diet is more important, or addressing the way we eat is more important than exercise. I actually have patients where I discourage them from starting an exercise program if we don't yet have a healthy relationship with food, because exercise has many benefits, and I'm big on exercise. I have my own weight equipment in my clinic for my patients to use. But exercise can and does increase people's appetite. So if we are not yet aware of our eating habits and why we eat, and we're still not mindful when we're eating, if our appetite goes up, so too will our consumption of food. And then we hit that cycle of frustration where we're exercising so hard, but we're not losing any weight. So I focus first on diet. How are we eating? And that's why my initial recommendation for the majority of my patients is that they would do a food log. I'm not big on calorie counting, okay? I don't think it's sustainable unless you're athletic and it has something to do with your performance and every little data point counts. I'm not a big proponent of calorie counting. However, the mass majority of the people that I care for aren't actually aware of the amount of energy they're consuming. They don't know how many calories are in their normal day-to-day meals. Most people, not all people, but most people who feel like they don't eat a lot don't realize how calorie dense their meals are. For that reason, I do recommend the use of some sort of calorie tracker for about 1 to 2 weeks. I'll put it to you like this. I do the same thing for blood pressure. Every time my patients show up to the clinic with elevated blood pressure, I tell them, track your blood pressure at home for yourself so we get a sense of what the reality is of your blood pressure measurements, right? Same thing is true for your food consumption. Track your food for about 2 weeks. Every single thing you consume, put it on one of those calorie tracker apps, and then review it with somebody who can give you feedback and tell you, are you eating as much or as little as you think you are? Once you have a sense, don't change anything. Just eat the way you normally do. And once you have a sense of how much you eat, then you can start to make adjustments. Are you overeating? If you're undereating, do you need to begin to eat more regularly? And are there signs there that maybe there is a metabolic disturbance that needs to be further worked up? And with that, the last thing I want to leave you with that's very essential in your weight loss journey is your relationship with food. I want you to ask yourself, what do you think food is? If you only think of food as energy, if you only think of food as a necessary evil, if food is associated with bad experiences, that's going to make the weight loss journey very challenging. I will propose to you that food is much more than just energy. Food is even culture. I'll tell you, cultures are defined by the kind of food that they eat. Food represents values, and most of us can associate a plate or a particular dish or a drink or something with special memories that we have, because food is an important part of life. It has such a big social component to it. For some people, it has a religious component to it. So examining our relationship with food and putting it in its proper place, not being afraid of it, not being obsessed with it, not categorizing it as good versus bad food. This is not a moral issue, but coming to a place of peace and a healthy understanding of what food is in your life is an important part. Once again, if you are looking for somebody to help you, I am happy to help you. And if this video was useful for you, please feel free to like, to subscribe, and share it with others as I'm trying to get the word out that weight loss is medicine. Weight loss can help us stay away from other kinds of medicines with bigger side effects. Thank you so much for watching this video. Thank you so much for sharing. God bless you guys, and have a blessed day.